What do you do to take care of yourself?
Welcome to the Unfiltered Healing Podcast with Dr. Rachel Hamill.
I ain't Dr. Phil. I'll truly help you heal your mind.
Connect with alternative medicine innovators that will challenge and empower you.
It has the potential to change your whole life.
Create natural balance for both your body and mind.
Your health is very important.
All while uncovering the truth behind modern medicine.
This is crucial.
It's raw, it's real, and it's unfiltered. Here's your host, Dr. Rachel.
All right. Well, Dr. Adam, welcome to the Unfiltered Healing Podcast.
Oh, I'm so honored to be here.
Well, nasal breathing in particular, which is one of our topics, is certainly one of the biggest topics of my following, my patients, a lot of people, and for good reason, because it's such a huge part of health, brain health, optimal health. And what we'll be talking about today is probably not something that a lot of individuals are aware that they can have access to or available to them, or just how much it can really change when your breathing is restored. But before we get into all of that, would you mind giving our listeners just an introduction of yourself? Who is Dr. Adam?
Well, I'm a chiropractor. I graduated sometime around the fall of the Roman Empire, way back in BC times. I've been around for a long time, practicing 39 years. I had two practices in California, one in Burbank, one in Catalina Island, where I was their chiropractor out there for like 32 years. I've recently retired and dedicated my life to advancing and teaching this specialized cranial balloon-assisted cranial adjusting technique that we call Cranial Facial Release. It's where you put balloons in the nose and inflate them, and it just opens up your whole cranium. And specifically, as you mentioned, Doc, your breathing passageways. So I am the founder and developer of that technique, and I am now just touring the world, teaching seminars and trying to help other doctors learn this specialized procedure.
Now, in the span of your career, when did you start really focusing on learning about like the cranium and the facial? And was it something that kind of developed, or did you always kind of have an interest of that? How did you get into learning about the cranial facial system?
When I was a teenager, both my brothers, one of my brothers got braces and developed all these bizarre symptoms like headaches and eye pressure and fatigue. And he kept having chronic recurrent ear infections. And my other brother, we were wrestlers, so he fell on his head and developed vertigo. And we went to every single doctor on the planet. We went to everyone and nobody could help either one of them. And then someone told us about this chiropractor who was a cranial specialist down in El Cajon, like San Diego area. And I don't even think I knew what a chiropractor was at the time, so much as a cranial, much more, than a cranial specialist. But we went down and saw this man. His name was Dr. Cleo Bloodworth. And he, in a matter of like 3 to 4 visits, both my brothers responded very favorably to his cranial adjusting, which was very subtle. It wasn't a lot of work. It was minimal, actually, subtle movements that he did on the cranium. And from that point forward, I just wanted to be like him. So from that point forward, I wanted to be a chiropractor. And that was it. That was my first introduction.
And so that's great, because a lot of people in the chiropractic field, they don't really know much about cranial motion or things of that nature. And we're not really taught much in school. So you had a pretty early on introduction into that, that developed into kind of your, technique that you created and all of that as well.
Yeah, it was from that point forward, I set my sights on being a chiropractor. I was totally blown away at how they could heal people by just placing their hands on them. It was almost biblical, I'm like, wow, that's amazing. I want to do that. So here I am.
Here you are. And so when did you start digging into the technique that you've developed now, was that like a certain timeline in your practice of learning cranial and then it developed into something else, or how did that kind of develop?
Well, it was fresh out of school, and I went to my first Parker seminar, and Parker has like 6 or 7 seminars going on at the same time, and you can pick and choose. So they were teaching cranial adjusting upstairs. I'm like, oh, I want to know cranial from Dr. Bloodworth's influence on me. So I went upstairs, and they started talking about putting balloons in people's noses, and I was like, are you insane? I mean, literally, because of course I knew everything back then, right? And I got up and walked out. I walked out of the seminar because it was just too bizarre a concept for me to wrap my head around, and I just left. And about 15 years later, one of my buddies sent me like a fax. It was before email, about this lady who had fallen off a horse and hit her head, and had post concussion syndrome, and went to every doctor, every neurologist on the planet. Nobody could help her. And then went up and saw this guy in Washington who did balloons on her, and gave her life back. She was brand new. And I was like, oh, yeah, I remember this technique. And so I don't even know why, doc, but I called the guy up and was inquiring, like, about the technique. And he's like, oh, yeah, I'm just getting ready to teach my first group of doctors ever how to do this technique, and I got one spot open, and do you want it? And I don't even know why I said yes, because I was like, I don't need to do this. This is crazy. Like, who thought of this anyway? And it was buyer's remorse the whole way. I mean, I was just like boarding the plane. I was telling myself this is silly, and like renting the car every step of the way until I got that first balloon. And then I was like, holy mother of God. It was a whole different level of adjusting. And then it was like someone just turned the lights on,
Yeah.
and then I got it. And from that point forward, it has been life changing for so many last resort patients, who've tried everything. Just like the lady in the story, everything. And they've given up hope of ever getting better. And again, the most obvious thing that we're talking about is breathing. I mean, that's a no brainer, snoring, sleep apnea, sinus conditions, deviated septums. That's like 100% or almost. Well, nothing's 100%, but like 99% or, but all the other things that people don't even think about, like Bell's palsy, trigeminal neuralgia, post-concussion syndrome, like the lady, post-stroke, people that have had stroke, people with neurological conditions like Parkinson's and MS, that it doesn't cure that, but it just optimizes their brain level function to whatever is optimal for them. For it may be like 60% of us, but it keeps them at that optimal level. So just life-changing.
Now, before we get into like what exactly this technique does and the nitty-gritty of that, because, most of my listeners do know, but there may be some that may be newer and not know much about the cranial system, how it moves, how it gets, disrupted. So would you go into a little bit, like, what are some of the ways, because you talked about some like with concussion and whatnot, that the craniofacial structure actually gets imbalanced and then, necessitates the need to return to that, normal motion that we know as doctors, but people listening may not know. So what are some of the ways that this structure gets imbalanced?
Well, to understand how this technique works, it's important to realize that the skull is not one solid bone. It's made up of 22 individual bones that move every time you breathe. Like every time you inhale, your skull expands, and each of the cranial bones have their own direction of motion, or at least they're supposed to, with the purpose of pumping cerebral spinal fluid throughout your brain, which is like, they call it liquid light. It's the sacred juice. It's the stuff that bathes the nervous system, and specifically your brain, and gives it life and vitality. So if you have a fixation of one of those cranial bones and it's not moving like it's supposed to, or which, there's also the covering of the brain, which has, they call it the dura, the meningeal system. If there's torque on that, which will also cause impediment of cerebrospinal fluid flow throughout the brain, it gives rise to a whole gamut of neurological disorders. So the things that cause that to happen are like head trauma, like the lady that fell off the horse. If you have, or birth trauma is another one, because sometimes, children, they have forceful deliveries, not the fault of the doctor. Sometimes there's complications, or they use forceps or suction extraction, or if you have like a TMJ disorder, where you have an uneven bite force that translates up through the skull. Every time you bite down, you're having uneven pressure being translated up through the cranium, which will cause cranial fixations to that part of the cranium. Whiplash injuries are another one, that cause what they call impulse concussions, as opposed to like head trauma, like direct trauma. That's what they call an impact concussion. But the impulse concussions are more responsible for that dural torque thing that I was talking about. But anything that interrupts that cranial respiratory motion will have dramatic negative effects on neurological function and specifically the brain.
Yeah, and you mentioned even with your brother, like braces and orthodontics and things of that nature as well.
Absolutely. Sorry. Yes, that's a big one. Now, there's different type of orthodontic procedures. I mean, as orthodontics has advanced, they are starting to do like functional orthodontics, where instead of pulling teeth and trying to make the occlusion come together neatly by compromising the cranium, what they'll do is they recognize cranial distortion, and they will put like an alpha appliance or some type of a palate spreader behind the teeth, which open the palate and allow those teeth to drop down into place where they're supposed to. And then, which it's important, you also have to address the TMJ component of it, so that the jaw then lines up and occludes with the upper newly formed alignment of the teeth, so that they come together like there's with the normal occlusion.
Yeah. And we're kind of talking for people about necessarily a different paradigm of this, because typically when people have breathing issues, they'll go, for instance, to their ENT, and then they'll recommend, if they're conventional, most of the time, like a sinus surgery or something like that to open up the sinuses. So can you go into that a little bit? Because you personally in your practice, and mine too, see a lot of people that have done sinus surgeries, all of these surgeries, and they're still having difficulties. And that's because the paradigm that you're talking about is completely different.
Well, I mean, yeah, Doc, the old saying, if you have a hammer, every problem's a nail, right? Yeah. So, I mean, that's what they're taught. They go to school to learn that exact approach to treatment. So it's not that they're wrong. It's just that that's all they know. They don't. And the thing is, my brother's an MD, so all due respect to MDs. I mean, medicine is so important. But, most of the time medicine is what they call in Australia crash care. It's emergency care. They deal in their paradigm is disease and disorder, where chiropractors deal in the paradigm of dysfunction. We believe everything is a dysfunction, not a disease. Long-term dysfunction eventually will give rise to a disease. But if you address it as a dysfunction, then you can a lot of times correct that dysfunction. So they go in and they see a deviated septum and they're like, oh, we need to roto-rooter everything out and may open up the breathing. And we're like, well, why is the nose deviated? Is it because they have a narrow palate? And then there's no room for that septum, so now it has to deviate one way or the other. Well, let's address the palate, and then balloons to allow that septum to return to midline. I mean, that would be functional approach to it, as opposed to, oh, it goes this way, let's just drill it out and open it up, but you don't address the primary issue, which would be the narrow palate. Or if it's traumatically induced, now you've got, you've got scar tissue in there, and so now they're going to go in there and induce more scar tissue as they rip everything out. And how do you think the area is going to heal? Is with collagen and more scar tissue. So that's why, it does work a significant amount of time, but just as many times, the fact that the scar tissue then forms in there, and it goes back to occluding the breathing, even though the septum has been removed or straightened. So and then they got to go for another surgery and another surgery. So we oftentimes get people who have failed septoplasties and then come in and get the balloons done, and it mobilizes that area again, breaks up the scar tissue, opens up the breathing. It's more of a functional approach as opposed to like a surgical, more radical approach, I guess.
Yeah. And specifically, can you go in a little bit to, we talked about, you talked about how the cranial bones move, how they can get, disrupted in that movement. And you talked a little bit about the cerebral spinal fluid. So that's the spinal fluid in your body. Can you go into some of the ramifications then of, we talk about breathing, but what are some other types of ramifications of, this cranial system really not moving properly, and that fluid pump not moving properly?
Well, yeah. The brain depends on a lot more than just cerebral spinal fluid. The primary thing that it depends on is oxygen. It's O2. You can go 45 days without food. You could probably go maybe 7 days without water, but you can't go 3 minutes without oxygen. If you have hypoxia to your brain dies. And even if you have a less, like not completely shut off from oxygen, but you have a decreased flow of oxygen, your brain still goes into a mild state of hypoxia. And what happens is your CO2 levels go up. And this is what causes things like chronic fatigue. It breeds an environment of acidity in your body, which is a breeding ground for cancer. It causes all kinds of neurological problems, but, it also, by mobilizing the cranial system, not only do you increase the oxygen flow, you increase the blood flow to the brain, you increase the venous drainage from the brain, the lymphatic drainage from the brain, you take the torque off of that dura, and as we spoke about in the seminar, there's been so much research that supports the fact that any type of mechanical pressure on the control centers of the brain due to cranial distortion or asymmetries of the cranial bones, that just pressure of the cranial system on the brain and the nervous system causes a distorted impulse to be formed at the source of the impulse as it goes and tells the rest of the body how to function. So that distorted impulse, according to A.D. Speransky, who did 11 years of research on this topic, it is one of the primary reasons of visceral disease in the body. He was able to name over 80 specific diseases that he could consistently reproduce over and over, just by doing nothing more but putting mechanical pressure on certain control centers of the brain. And it was a consistent outcome. So his determination was that one of the primary causes of visceral disease in the human body is nothing more than mechanical pressure on the control centers of the brain. And that's huge. That's the father of modern medicine saying this. That's not a chiropractor with his hypothetical esoteric views. This is medically proven.
Yeah, and I'm really glad you highlighted that again, because I wanted people to hear that, as we are talking about breathing and oxygen, absolutely, that there's such a even bigger impact on this than people even know because of the brain and the control center of everything in our body. And so over 80 different visceral diseases, that's wild,
Yeah,
that even a
consistently.
small amount of little pressure can affect so much in your system. And so I'm really glad you re-highlighted that, because that's important for people to hear too, of just chasing all of these things when it could just be mechanical pressure on your brain. So
Absolutely.
so going back to after you had this nasal ballooning experience on yourself, because I'm sure at that point you were already invested in doing other types of cranial work or had
Yeah.
done that in your practice. So then what was it? How did you begin to trail into, okay, now I need to do this? Because CFR, which is what you, the technique that you formed, it's not the only technique. And so how did you then begin to develop like what you were seeing and what you were experiencing into what you do now, which is actually quite different than others? So can you go into that a little bit?
Yeah. I mean, like you, Doc, I'm a SOT based doctor, sacral occipital technique. And we recognize the direct relationship between cranial function and sacral function and its role in pumping the cerebral spinal fluid throughout the brain and spinal cord. So, most of my practice, even before cranial work, was SOT based, which is what actually got me into cranial manual cranial adjusting and understanding cranial function. And then, so even when I started doing the balloons and incorporating that into it, everything was still SOT based. And so my whole analysis system, my whole approach to the body as a whole, looking at it from both ends, and also, trying to clear everything below the occiput to take the torque off the dura before we even started doing cranial work, was just something that came from my SOT background. And, this is just the way that I was doing it. It's not that it was right or wrong. It was just my approach. I had been doing balloons for like 15 years prior to when, to answer your question, one of my patients was the executive producer of the E Channel. And she was like, "Oh yeah, you do that weird balloon thing." And she's like, "Yeah, we want to do a TV show on it." I was like, "Oh, wow. All right, cool." So, I just thought it was going to air in and around LA, but it went global. I'm not even kidding. I mean, the first call I got was from South Africa, from some patient wanting to know where they could get it done. And the second call I got was from Australia, from a doctor wanting to know where they could learn it. And I was like, really? Like,
Yeah.
people want to know this? And so at the time I had learned it from the gentleman, the doctor up in Washington, and he called it something different, but I had broken away from his tutelage and his training, completely did like the exact opposite of everything he taught me, except for inserting balloons. His analysis system was just something that didn't resonate with me. It didn't make sense to me. And so I started doing everything according to a consistent, reproducible approach that doctors would consistently be able to incorporate, even if they didn't know what the other doctor had done, based on SOT protocols. And so I just called it cranial facial release. And once my phone started blowing up, I'm like, wow, maybe I should teach my version of it. So,
Yeah.
and I know what I'm doing, right? I put this together in 2 or 3 months. Oh my God. It took like 4 years to actually articulate everything word by word, like step by step. And I had a lot of help from Dr. Jeff Mirsky, a lot of help from Dr. Glenn Frieder, both of whom really helped me develop this program and to what is now known as cranial facial release.
And the instructor that you first learned from, he learned from someone else, because I forget the exact year that you taught us, but when nasal ballooning actually began, was it in the 40s or was it later than that?
Oh man, no, it was even earlier than that. I mean,
Okay.
the doctor who is considered the pioneer of this
Mm-hmm.
technique is Dr. Richard Stober. He had a technique called bilateral nasal specific, or BNS, and he was influenced by other practitioners that from the like early 1910s. I mean, originally they were doing it with like popsicle sticks, recognizing that this nasopharynx area, which is like where the whole reticular activating system, where all the input from your internal environment is processed right there before your brain decides how to respond. That's that whole area right here. And they recognize the importance of that. So any fixations or distortion in there would cause an aberrant, distorted message to be sent back. So it wasn't being processed properly, and which would again give rise to the visceral disease. So they started using popsicle sticks, and they would or their fingers, they would use fingers, right? And they would go in there like Heller work would do, and it would be like, bam, like, holy wow. It wasn't comfortable. It was way less comfortable than the balloons are. And the balloons don't hurt, it's not a painful procedure, but that was. So then they developed, maybe we can start using finger cots. So, but Dr. Stober was actually the one who put it on the map and developed his BNS. And he's the one that actually carried the torch forward and really made it a recognized technique.
And you said he used to do it primarily on children. Was that right?
Yeah. We're talking about doing it for the most obvious thing, which is breathing and oxygen flow. And he primarily did it for brain function, and primarily his biggest target audience were Down syndrome children.
Wow.
Down syndrome children that had, and not that they would ever become 100% non-Down syndrome, but their cognitive levels elevated to such a high degree that many of them went on to just live normal lives. I mean, you can go to this one guy, David Jones is his name. He has a website called nasalspecific.com, and you go on there. He has videos. He talks about his story of how he used to go to Dr. Stober as a child, and he elevated to such a cognitive level that he went on to get not only one but 2 bachelor's degrees. He got married. He held down a regular job. He had kids. I mean, and he tells his story from his own lips. He shares his story on that website.
Yeah, that's awesome. I mean, we see that a lot just with craniopathy care. It changes a lot of development in the child for sure.
Huge.
So creating CSF and oxygen and all of those types of things. Okay, well, let's get in a little bit now so you talked about, there are some other techniques out there you developed through your knowledge, through your education, through your experience, then cranial facial release, which is more of a whole body approach to addressing that versus, do some of the other nasal ballooning do any of the rest of the body either, or mostly just the balloons?
Well,
do you know?
I know, there's one doctor in particular who is just a rock star, just amazing doctor. His name is Dr. John Lawrence, and he does functional cranial release, which I don't have evidence of this, but I think once that E-channel video came out and I started calling it CFR, I'm like, I'm going to call mine FCR, which is like, wait a minute, if you're dyslexic, you'd end up on his site, right? But I don't have issue with it because he really is an amazing doctor, and he brings in like functional neurology into it using LED lights and left and right brain stimulation. He does a lot of like Stober's naturopathic remedies that also augment brain function. He attended my seminar. Actually, I just out of a courtesy allowed him to attend, and I don't know if he was doing SOT style, like addressing the body from an SOT standpoint, but he did address other things than just doing balloons. Again, mostly from a neurological approach. There's also like Dr. I don't even want to say his name, the guy that I learned it from. He would pretend to do like this body clearing thing. But again, I mean, it just didn't make sense. Like I would ask him, why are you doing that? Like, how does that have any correlation with what we're doing on the other end? And he just never had an answer. It was just his clinical experience. And instead of going, well, because the dura attaches here and this distortion will cause torque over here. And so we clear this it was never any of that. We're trying to actually get George Gonzalez's work incorporated into what we do with his quantum neurology, because that's amazing stuff too. Yeah. And so we really are in an evolutionary stage right now. And, I've been practicing for like 40 years. I think this is my 40th year. And now that I've taken a step back from practice, I really have a lot of high aspirations and lofty goals with how to advance this technique and incorporate these other like just amazing modalities to make it a complete approach to cranial, therapy and treatment.
Yeah, it's exciting. So after you've balanced the body, we're just going to simplify it that way for people. You've balanced the nervous system. As far as from the neck down, which is part of SOT protocols that he's talking about, is to balance the rest of the body kind of before you get to the cranium, which is really important. But after that's kind of done, then can now you talk about the actual process of what happens through the nasal ballooning and how that also differentiates from, I know you mentioned this in your video, but the surgical operation of nasal ballooning, because it's very, very different. So can you dig into that a little bit?
Yeah, I mean, even aside from surgery, they also do a procedure called sinuplasty, where they insert balloons in the nose also. But what we're going into the area called the nasopharynx, which is the area between the nose and the throat. It's like here, that area, like the area that goes from the nose down into the throat. So there's 6 openings. There's 3 on each side. There's an upper, middle, and a lower. And so in CFR, what we're doing is determining the most appropriate opening to inflate, as opposed to every other technique that's out there, like bilateral nasal specific. Then there's another one they just call nasal specific. There's, John Lorentz's FCR. There's, what does Cindy Stein call hers? Cranial specific or nasal release is what she calls hers, nasal release. But the thing that they do is just go in and balloon all 6 openings. They do all 6. And the way that Dr. Stober taught it is he would do all 6 and then do the lower 2 again, because he would start from the bottom up and then would do the lower 2 again, because he said as you move up, it collapses the lower one. So he would do a total of 8, and that's one day of treatment. Where we are, it's a lot. Yeah. So what we do is we try to do more specific inflation patterns, using mostly diagonal patterns. Like we would do a lower and a middle, or a middle and an upper, mostly targeting the specific disorder. Like if you had like a Bell's palsy or a trigeminal neuralgia, we would want to target it like this way, like try to open it up this way. So we would do like a diagonal, like maybe a lower and a middle, targeting like opening up this area. So it's much more specific. It's much less invasive, much less, I don't want to use the word traumatic, because it's really not traumatic. Maybe, it changes so much how it's done. I mean, or how it feels. Like the first couple times you get it done, it's a lot more pressure than like the 3rd, 4th, and 5th time. And then it just becomes like a piece of cake. It literally goes from like an 8 to about a 2 in about 4 treatments. And then after that, it's such a tolerable treatment, But what we're doing is we're primarily targeting this bone called the sphenoid bone, which is the primary central bone of the cranial vault, and where it articulates with the occiput, where what we have is called the sphenobasilar junction, and that's the primary pumping mechanism of the whole skull. So we bubble the balloon into the throat. That's the desired effect, to target that specific articulation between the sphenoid and, well, the palatine bone is what we're targeting to induce that motion of the sphenobasilar junction. So, we do patterns, whereas they just do everything. And then sinuplasty, which is what the medical doctors do, they're actually going into the sinus cavity. See, we're not entering the sinuses. We're entering the 6 openings of the nasopharynx. The sinuses are like here to the side. These are your maxillary sinuses. Then you've got your frontal sinuses. And then you have your ethmoid sinuses. You got the sphenoid has its own sinus system. You got your mastoid sinuses. So they're actually taking like a catheter, which is like a rod, and they fish their way up into the sinus cavity. Now, the sinuses have like small openings that empty into the nasopharynx. So we're able to accomplish a similar effect by just opening the nasopharynx and allowing that backage or that blockage to now drain out of the sinus cavities into the nasopharynx. But they just go directly through that little hole into the sinus cavity, and they use like a catheter or a balloon once they get the little wire up in there, and then they expand it so it opens up the portal from the sinus cavity into the nasopharynx, and then everything drains out. And then I believe they put some type of an antibacterial that they spray in there to keep it from returning. And so that's a procedure that needs to be done under anesthesia. I mean, you don't just go like with us, make an appointment, 3 seconds later it's over and you're driving home. I mean, you're out cold, it's not, that's not a tolerable procedure that you could be done just in an office without anesthesia. So,
and the actual structure was never changed, right? So they just drilled things. So the actual structure of what caused the drainage to pool up in the first place was never really accomplished. So,
well, again, a total medical approach. Here's the situation. Let's target like the symptom,
Sure.
not the cause. I mean, we treat the cause, and then the symptom is as a byproduct is resolved, where they just treat the symptom regardless of what the cause is, and with a pretty fairly, I guess, high degree of success. But it's recurrent now. If you don't address the original cause of the problem, it's going to be recurrent treatment, which may be a business plan. I don't know. I don't think that they think like that. I think that they just do what they're taught.
Yeah. Are there any specific contraindications to CFR or nasal ballooning in general?
Well, I mean, the most obvious one I can think of is people that are maybe hemophiliacs or that are on blood thinners, because probably in the beginning, 50% of the time you're going to get a little bit of a nosebleed. And, you'd rather not have them bleed out as opposed to being able to breathe. But I mean, that's probably the main one. Anyone that's had surgical plates inserted in their facial structure, that may be a contraindication. Someone who has maybe an aneurysm, like a brain aneurysm, I would be hesitant to increase that intrathecal pressure, just because, I mean, eventually that thing will probably burst anyway, but you don't want to be the one standing there when it happens. They have concha bullosa, which are like outpocketings, like bony outpocketings in the nasal passageways. It's not really a contraindication. That's probably why they're coming to you, because it's blocking their breathing. But, it's just a consideration, I guess is the word. You also have a thing, it's called a chonal atresia, where the whole back area of the nasal passage is blocked. It's a congenital thing from birth. And it just, there's no air that goes through there. It's either a bony blockage or it can be like membranous, but you're not going to be able to get the balloon through there. It just won't go. So,
Yeah.
but other than that, I think they're minimal contraindications.
I would say another one is that blocks the sinuses is polyps as well, right? Those are like really common. Polyps. Not contraindicated, but it's another
consideration. Yeah, it's a consideration. I don't think that you would not be able to do balloons with polyps. As a matter of fact, a lot of people come in and then we discover they have polyps, but we still balloon them. It doesn't cause an adverse effect. It just, it probably won't fix the polyps, but it might open up the breathing,
Have you seen them come out?
I have heard that they've come out. I have not personally seen it. So no, but I've been told by several practitioners that, well, actually there was a picture. One guy sent me a picture of his polyp that came out when it was George Gonzalez, actually. Wow. George Gonzalez actually sent me a picture of a polyp that came out of his nose. Thank you for reminding me of that. I gotta include that in the PowerPoint for sure.
Yeah. And you talked about as well, like, I think it was a lady that had like a massive mold, like spore or something come out of her sinuses.
Yeah, we saved her life. That was crazy. It was that was actually a doctor at one of my lectures, and who stayed after, and she was like, I just have this pressure like in the back of my face and I can't explain it. I've done everything, nasal rinses, and I just don't know what's causing it. And we ballooned her. Oh my God. I mean, she coughed up this big black like glob and I was just like, where the heck did that come from? Like, I was like, how was that even in there? And where would it like emerge from? And she's like, I'm saving it. She was so cool. I'm saving it, and she put it in a cup, and I'm like, whoa, I'd be flushing that thing down the toilet. But she took it and got it analyzed, and it was aspergillus. I'm saying it wrong. Aspergillus fungus. Yeah. And they were like, oh my God. The doctors are like, this was eating its way through your bone. Oof. And it had progressed to a fairly, advanced stage. And you are so lucky that you discovered this and got it out of there, because if this entered into your cranial vault and into your brain, you would die. There was nothing we would be able to do for you. And so I guess it was a life-saving experience, but that was very bizarre.
Yeah. And well, I mean, mold in general is a huge one that causes so many people to have sinus like congestion and breathing issues. And then that can even change the structure of their face because they're mouth breathers. So that's pretty cool. What are some other, I mean, I'm sure you have like hundreds and thousands of stories. What are maybe some other like really profound cases that you've also had come up over the years that just really like stand out to you after incorporating this technique?
Well, I mean, you ever find anybody with trigeminal neuralgia, man, their lives revolve around that. It is the most miserable thing to endure. Those symptoms of just facial pain are insane, and it ruins their lives. And I've had people who have tried everything on the planet. I mean, from like nerve ablation to, heavy doses of drugs, doing like freezing it, everything. And then they come to you and again, addressing the cause of the problem, the cranial distortion, the torque on the nerve, and taking and addressing the cause instead of just trying to get rid of the symptom. And those people are just patients for life, and they tell everyone they know, and be careful what you wish for, because you help one of those and your practice is going to blow up. Bell's palsy, of course, that's one where it's, doctors say that it's self-limiting, but there's a specific cause. It's idiopathic for them. Hypothesize what they think is the cause. It's a virus. It's, torque or I don't even know what their different versions are. To me, it's torque on the cranial nerve that causes, facial paralysis. It's the facial nerve, the seventh cranial nerve. And so, that's like the highest success, but I mean, like crazy stuff, like emotional disorders, I had a girl was like locked in her room for 3 years. Like she never came out. They would slide food under the door. And her mom came to me and she's like, it was right when I first learned it. And I was in Catalina and I was ballooning everybody. I ballooned every single person on that island. And she heard about it because everyone was talking about it. And she goes, "Oh, do you think it would help my daughter?" And I was like, "Geez, I don't know. We can try." And her mom's name was Rachel. I was like, "I don't know, Rachel. We can try." And so she brings her daughter in, and she was all covered in blankets, and like couldn't even see her face really. And I ballooned her a couple times, and oh my God, that girl just blossomed. She actually turned into trouble. I mean, she came out of her shell, man, and she was back. And she even walked in my office, and the doors burst open. It was like a movie almost. And she was very attractive. And she comes sweltering in, and she's like puts her hands on her hips, and she's like, "That's right, Doc, I'm back." And I'm like, "Whoa!" I used to see her out and about at 2 a.m, like where she shouldn't have been, and partying like a rock star. And she started dating the lead singer in the band. And I mean, it really changed her life.
Sure.
I had one woman who used to like suffer from anxiety, and when she was having one of those episodes, it was almost like she was possessed, like a demonized possessed. And I remember when I walked in, I was like, "Oh my God, call a priest. This isn't like a chiropractic thing." And her mom's like, "Please do something. And I was like, I can try this one thing." And so we ballooned her, and I swear to God, it was like all the color just came right back into her face. And this, whatever it was, just disappeared. And she just looked up at me and said, "Thank you."
Yeah.
And, she went on to have relations with her husband again. I mean, they were like 8 months of no like contact. Their marriage was going like down the tubes. She ended up getting pregnant, having a baby, and saved her whole marriage. I mean, it's those sort of things that are just life changing.
Yeah. It's amazing. You're changing the brain. So,
well, again, and you know what, Doc? You just nailed it with that. Chiropractors get 80% of their patients well by adjusting 20% of the nervous system. When you tap into this other 80%, it's a whole different level of healing.
Yeah, it is. We see it all the time, even before I incorporated balloons, just with cranial work. So it's so profound. And I think the reason why this subject is gaining more and more steam, I mean, I've even seen in LA, I was telling you at the seminar, like big time ENT in LA talking about ballooning and cranial work, and it makes me excited because I'm like, awesome, we can all work together, and there's more actual knowledge coming around this topic, which is why we're putting this podcast out there, is to let people know you don't have to suffer. There's lots of answers out there to help you. With this technique particularly, are the changes that you're changing in that person's cranium, are they permanent? Or is it something, that's a question that, people will ask a lot of the time. Is this something that then I'll have to do forever? Or is this a permanent type of change?
Yeah, no, I mean, my experience has been so it's done in a series of 4 days of treatment. That's one series, but it typically takes like 3 to 4 series, depending on the situation. I mean, trigeminal neuralgia is a lot more than that. It's, more like 7 or 8 series, but, it's once you've gone through 3 to 4 to 5 series of it, it's a permanent result, and there's, again, though, let me prefix that by saying if the cause is, like a TMJ disorder. so that every time you bite down, now you still have that recurrent uneven bite force up through your cranium. Then you've got to address the TMJ. But
Sure.
the first thing to do is to make sure that the cranium is balanced and symmetrical, so then you can address the TMJ so it fits a symmetrical cranium, as opposed to trying to fit the jaw to fit the crooked door frame. You know what I'm saying? So
Oh,
that's
100%.
yeah,
Yeah, that's typically what happens.
so that might be a situation where it would require intermittent ongoing treatment, but it's not just one of these things you do for life. It's a permanent fix.
Yeah. Yeah, that's probably like a good 90% of the time what happens is that, they get braces or jaw, all this stuff with a distorted cranium, and then they come out of it worse. So we're talking about fix all these neurological, structural, mechanical problems first, and then, balance the teeth and the jaw and all of that stuff. And you're going to get way different results happening for that person. Now, where do you kind of hit on this a little bit? I don't remember how long ago, but where do you see this kind of expanding into the next few years now that you're kind of taking this on full time and teaching and training up? Because we're a relatively smaller group that's been really trained so far, but I know that's part of your mission. Like, where do you see this kind of expanding into, and your hopes and your calling of this?
Well, I mean, it is a specialized procedure, and there's not a lot of doctors doing it. I mean, we have patients, we need doctors, is what it is.
Yeah.
And now that I have dedicated my entire effort towards elevating, the recognition of this, and trying to incorporate more doctors into the training so that more patients can avail themselves of the treatment. I think it doesn't resonate with everyone. That's the thing. Like
Sure.
with me, the first time I heard it, I was like, are you crazy? Like, who would ever think to do that? But the
Sure.
doctors that get it are ones that have witnessed these patients that they just could only take to a certain level and knew there was something more. Like, that was me. I was like, man, I know that if I just knew just something else that I'm missing here. There's a missing piece, and I can't identify it. And then I can't even tell you how many times doctors go, oh my God, as soon as I heard of this, that was the thing that I couldn't identify or articulate. And then as soon as I heard it, was like, yes, that's it. It's that 80%, that they know, they understand from above down first before inside out, focusing on how that nerve impulse is generated, created, and produced at the source before concerning ourselves with how that nerve impulse is transmitted. So we've started a whole social media campaign where we're geo-targeting certain areas now, because most of the doctors that I was living in LA, so most of our seminars were on the West Coast, and we would do one in Miami, but the whole Midwest is untapped, and a lot of the practitioners, I mean, we probably have, I'm going to guess, maybe 400 doctors, that's it, that we've trained to do this in the whole world.
Yeah.
And 100 of them are in Europe, or other countries, Malaysia, Thailand, Mexico, a couple in Canada. We have a couple in Norway, one in Portugal, the Netherlands. I mean, we've got a lot of doctors. Switzerland, we have another guy in Switzerland. Germany, there's a few. But, as far as the U.S., this is a wide open field. I mean, there are such a high demand for this. And I get calls from areas that are like, Chicago, for some reason, is like the highest draw. Do you have anybody in Illinois? I'm like, I don't. I'm sorry. Michigan or, Mississippi, the South. Like, there's no one in Mississippi, Alabama, Arkansas. Oh, actually, I take that back. One of our doctors just did move to Arkansas. but it's so sparse,
Yeah.
the practitioners that we have. And so that's, now that I'm dedicating my life to it, I'm sure that it's going to, the awareness of it is going to be heightened throughout our profession. And I'm really hoping to just, before my day comes, before I go meet our maker, I'm just hoping that that's the impact that I have on the profession, is to spread the word
Absolutely.
of BFR.
Yeah, absolutely. And we so appreciate you for doing it. Hopefully, if there are some doctors listening, and we'll spread this out, that they feel encouraged and inspired to learn some of this for the huge need that's there. Absolutely. So what are some ways that people can find you, learn more about this, find people in their area? What are some resources there?
Well, I mean, we're in the process of revamping our entire website, and it is awesome. I mean, it's not launched yet, but I'm in awe of it, as compared to what we presently have up on the website, which is like I don't know, 2010 or something. I think it's so antiquated, but it's informative enough. So the website is cranialfacialrelease.com. You can go there. If you're a patient, you can click on find a doctor, and it goes state by state, so you can find doctors that are close to you. If you're a doctor, you can click on the seminar link up in the menu bar, and it'll give you a list of all the seminars, which we're starting. Like, I used to do 2 or 3 a year. Now I think we've got 6 or 7 seminars between now and next April. The next one coming up is going to be in Alaska, July 14th through the 16th. And then I think we just added another one in San Jose in October. And then we're going to go to Australia also in October. And then the next one after that's Miami in November. And then we're back in Burbank next March. And then Spokane again next April. So that, and we're going to keep adding more, but I need to, like I said, I need to get toward the Midwest somewhere. I think Arkansas is going to be where we're going to target, because the guy that's just moved there, he's got the facility to host it. So,
Cool.
but if anyone who's a doctor who's watching this wants to bring a seminar to their area, really all I need would be like 8 doctors to make it worth my while. If they could bring 8 together, and then if they organize it, I would, of course, give them special consideration for the seminar. But I'm serious. This is a game changer. It will elevate your practice to a whole new level, to the point where you're going to start witnessing miracles like you've never seen before. Not that we don't witness miracles now, because we do. I mean, as chiropractors, how many miracles we witness in our office every day? I mean, the deaf man can hear, right? And that's only adjusting from the neck down. 80% of the nervous system is up here.
Yes. Amen. Amen. All right. Well, we thank you again so much for this episode. Thank you for taking time out of your busy schedule. And we just honor you for the legacy that you are creating and continuing in our profession to help more people. So we thank you for that.
Thank you.
We thank you, everyone, for listening to this episode. Please share, like, subscribe, and blast this out so more people can hear about this amazing technique and get freedom in their health as well.